first instance, somehow the first reaction is to tell the patient that, oh no, it's all in your head.
Probably 6 months back, they were saying everything in your mind. Now they're saying, yes, it is long COVID, but we don't know what's going on.
After the first cases of COVID-19 evolved, the world observed a new phenomenon. Patients walked into hospitals with symptoms long after the disease was thought to have run its course. Here, for these people, a negative certificate didn't always mean a full recovery.
Two symptoms I will clearly put it down. One, fatigue, and second, the visible symptom that I can talk about is again my heart rate or pulse, whatever you call it, that going up drastically.
I had a fever that lasted over 15 days, and in July I sort of went down in my colony to purchase vegetables and some groceries, and on my way back home I had severe sweating and my heart rate went up and I just blacked out and I collapsed. And I think that was the beginning of my symptoms sort of worsening, and by March I was pretty much bedridden. I could not walk without fainting. I was blacking out every time I changed my position.
Long COVID is known to cause heart problems, diabetes, and brain fog in healthy, high-functioning people. From tinnitus to changes in the menstrual cycle to depression, patients have experienced and described numerous symptoms. So why is the list this vast and varied?
One of the key definitions in post-COVID or long COVID, post-COVID specifically, that a symptom, if it persists beyond 4 weeks or 28 days, then only it will be called post-COVID. Whichever part of the body is affected is likely to develop symptoms, and those symptoms could vary because this is not only the direct effect of the virus but also immune response of the body. So our immune response system is unique to entire body. So essentially when we put two things together, direct effects of the virus, the remnants of the virus which is linked to that, and the immune response, essentially these two things can reach any part of our body. Now it's very difficult to predict which organ of the body will be affected adversely because the virus is there or immune response is happening, and it's really impossible to detect.
This broad range of symptoms mean that doctors can often have a difficult time diagnosing patients correctly.
These post-COVID, long COVID, it's really difficult to diagnose these conditions. What one need to do, you have to exclude the common condition, and then only you can say that now you have this post-COVID. So it is very much possible that some of the conditions which are being termed as post-COVID, long COVID, were the undetected health condition which have been worsened by the SARS-CoV-2.
So how has the government responded?
In mid of 2020, Indian government launched some guidelines on that, how to manage long COVID, post-COVID. Then September 2021, Indian government released a detailed standard operating procedure for managing post-COVID, long COVID. A few Indian states and some districts have also started such kind of post-COVID clinics, especially also linked to the mental health care services. But there is a need for more such kind of interventions.
Despite this, it's not easy for patients to get the treatment and medical care they need.
There is a lot of advocacy that is involved, self-advocacy. Like I had to self-advocate a lot. Even recently when I had to go to another specialist, I literally had to sit down and ask them how much time they had and if they had the patience to actually hear what I had to say. Now I go in literally with that sort of a, attitude, because of my past experiences where I've been gaslit, where I've been told it's all in your head. There was this couple that I'm in touch with who are from Karimnagar in Telangana, and they have been experiencing long COVID symptoms for the past 2 years. And they have been traveling from Karimnagar to Hyderabad. That's what they have been doing to just get tests and get proper, even to get a diagnosis. Now, I wonder how many such people are there in tier 2, tier 3 cities. I'm in a metro city, I'm privileged, I'm English speaking, I have access to tertiary care, I have to some of the best private hospitals. But what is the situation in the tier 2, tier 3, in the districts? What is actually happening there? And I think this is something that needs to be paid more attention to.
Even with the prevalence of COVID and long COVID, patients are still facing difficulties in managing their jobs and workplaces.
even before pandemic, even before long COVID, we need to actually acknowledge that not a lot of workplaces are very accommodating to people with different sorts of physical disabilities, or neurodivergent people, or chronic illnesses. They have not been very welcoming in that sense. So I don't expect things to suddenly change overnight because of long COVID.
When I see in India that awareness is not there, I mean, once that awareness comes in, then probably employers will start looking at what are the flexibilities required. Is there a timeline? How can we support employees more?
Who is going to drive these workplace accommodation conversation? It has to be also driven not just from the patients, but it has to be driven from the companies themselves. It has to be driven from the government themselves, literally saying that if somebody has a long COVID diagnosis, then you have to make certain accommodations for them.
Two, three things that can definitely be done. One, giving employees the flexibility of probably at least operating from home. Second, I think I'm still not sure if long COVID is part of insurance and all. My guess is it's still not. As and when the treatment comes in, these are going to be extremely expensive treatments. Third is, I think, having little more flexibility and understanding. The most important part is the understanding part.
So I think there needs to be an attitudinal shift in how we look at work and health, and I think this is the biggest lesson the pandemic has given us.
So, how can the Indian healthcare system adapt to deal with the challenges of long COVID?
With the post-COVID or long COVID emerging as a challenge, this is a challenge, but I also see this as an opportunity for Indian healthcare system. It is opportunity to revive or strengthen healthcare services for all the chronic diseases which people were waiting for the treatment, but also to link the traditional services of non-communicable diseases with the post-COVID symptoms. So I also think that there is an urgent need that at least every district has one, probably more, post-COVID or long COVID clinics and where people can avail services. I completely agree that this is an opportunity that online courses are developed for a medical officer in both government as well as private sector facilities, where these medical officers can be regularly updated about the newer treatment and advances in the management of long COVID, post-COVID.
Where do we go from here?
It can't be so difficult to put out public health campaigns in radios and advertisements, or do like programs on a Doordarshan or on mainstream media channels and talk about it. I think that's the need of the hour. I think we need to educate people about what do you need to do to not get long COVID.
I think three things broad. One, creating awareness. Second, and that has to come from the government. Second, doctors listening to patient. The third part is probably substantial funding coming into the research part of it.
Sensitize patients or individuals who develop SARS-CoV-2, strengthen government healthcare system. Government need to increase investment on healthcare system and make these services easily available for individuals who are using this thing. One of the area which really can be helpful in this is a teleconsultation, which has been picked up in the country in the last 2 years. It has been regulated, approved by the government. So teleconsultation services could be really useful in this. But as we are approaching the period when SARS-CoV-2 or COVID-19 will become endemic, but people might have a complaint of post-COVID or long COVID. So it's time that every level, every state government, including union government or private healthcare provider, start thinking of ensuring easy access for the people of post-COVID, long COVID services. This is the time to plan. Was a month ago, but time to plan is now, and we should not delay it any further.